A 17-year-old male presented to our hospital with recurrent epistaxis. After being seen by our otolaryngology team, CT angiogram was done. The CTA demonstrated a large, hypervascular mass in posterior part of right nasal cavity with extension into right side of nasopharynx and the sphenoid sinus. The bone window shows that the mass is causing bone expansion or remodeling but is not eroding the bone. Looking at the right pterygopalatine fossa, it is slightly expanded as compared to left one. Worth to mention, there is fluid density in right maxillary sinus, which results from the occlusion of the right osteomedial complex by this mass. A complementary MRI study was done. The mass is hypointense in T1 weighted images. It is heterogeneously hyperintense in T2 weighted images and shows heterogeneous avid enhancement in post-contrast sequences. Multiple discrete linear and dot-like hypointense areas are noted in both T1 and T2 weighted images, denoting highly vascular stroma. Of course, by now, all of you would have reached the final diagnosis, which is juvenile angiofibroma. Collaboration between otolaryngology department and vascular and interventional radiology department resulted in requesting pre-surgical embolization of the angiofibroma to minimize the blood loss during the surgery. Using a right femoral approach, the right external carotid artery was selected. A DSA run is shown here demonstrating its major branches. The right internal maxillary artery was then super-selected. This DSA run shows the hypervascular pool of the angiofibroma. This run is important in order to exclude any collateral supply to the orbit or the intracranial structures, as unintentional embolization can lead to blindness or stroke. After injecting embolization particles, size 150 to 250 micrometers, flow to the angiofibroma was stopped. Surgery was done successfully with minimal blood loss. The current slide mentions important information you need to know about juvenile angiofibroma. Please feel free to pause the video or get a screenshot. Thank you for your time and best wishes.